Welcome everyone, and thank you for joining us today for our IAQM webinar, Mitigating Air Pollution Exposure to the Young Children. Air pollution exposure to young children is a serious concern globally, since they're the most vulnerable to the health effects of traffic-related air pollution. Today we'll be joined by Ashish Sharma, who'll be focusing on this issue and this UKRI-funded PhD research project, MAPE. Ashish will be outlining the goals of this project and how they experimentally quantified the different exposure and mitigating strategies for young children whilst they're transported in different types of prams or trailers. Most of these research findings have been published into some of the high-impact peer-review research articles, such as the Environmental International or the Journal of Hazardous Materials. Our webinar speaker who will be presenting today is Ashish Sharma. Ashish is a civil environmental engineer by professional training. He has worked for 5 years as an environmental sustainability researcher with several prestigious research groups across the globe. Presently, he is an EPSRC-funded PhD researcher at the University of Surrey's Global Centre of Clean Air Research. Ashish is passionate about air pollution management, environmental sustainability, and air filtration. As always, there'll be a chance at the end for your questions, so please submit these at the Q&A section at the bottom of your screen, and I'll ask these on your behalf. Thank you so much for joining today, and I'm going to hand over now to Ashish.
Hi everyone, good afternoon, and thanks for attending today's webinar. Thanks firstly to Sappy for managing her time and for such a generous introduction. So I'll be presenting today's webinar on mainly highlighting some of the key findings and research highlights of this project, Mitigating Air Pollution Exposure to Young Children. So engagement with this project has been such a fantastic sort of opportunity. We started in the year 2017 and kicked off in 2017, and it has been really a sort of thrilling journey. I am Ashish Sharma, as Seppi introduced. I've been working for last sort of 5 years before joining this project as an environmental sustainability researcher, and I've been fortunate enough to explore some of the countries and sort of some of the prestigious research groups. I started first with my first master's in Gwangju Institute of Science and Technology at South Korea, and where I was fortunate to work with a very diverse sort of research group. And Gwangju, we were leading in sort of climate change modeling. And after that, also I have been sort of engaged on varying topics related to the air pollution exposure sort of quantification. Firstly, I did this study on mitigating climatic impacts of air pollution transportation in the Indian transport sector. Particularly, we were targeting the diesel vehicles and trucks. Diesel vehicles, including buses and trucks, and other sort of 2- and 3-wheelers as well. So now, without investing any further time on any other sort of discussions, I would straight away jump into this project. And this is how I've structured today's webinar. We'll begin with a very brief introduction to my present research group, which is the Global Center of Clean Air Research. And then I'll briefly highlight the key motivation and the background why we had sort of picked up this topic. And it will be followed with some of the key research findings and highlights. And then we'll highlight the mitigation strategies, followed by impact summary and the acknowledgements. So the Global Center of Clean Air Research is one of the multidisciplinary research center based in the premises of Department of Civil and Environmental Engineering at University of Surrey. We are based in Guildford. It is one of the very beautiful places in the southeast of England. So here in the Global Center of Clean Air Research, we are having state-of-the-art facilities for experimental and modeling infrastructure. We are a very diverse team, have a very diverse sort of representation of our colleagues from across the globe. We are running almost 40+ projects, and we have been but lucky to sort of manage up to almost 8 million plus pound of funding, and always the main sort of goal of our research project and engagement is to really transform the complex and sophisticated science into the simple solutions tailored to meet the needs of the citizens, school districts and authorities, local councillors. And we always sort of try to come up with some, sort of brief sort of summary as key highlights, which are very sort of easy and to follow and understand by the senior citizens and a very diverse sort of audience. So just a very brief sort of snapshot of some of the outcomes of our research projects. As you see in the bottom panel, that we have these guidance documents. One is in the blue color. This is the Mitigating Air Pollution Exposure Guideline for school children. And here we sort of presented some of the top level findings of our existing projects in and around schools, some of the campaigns we have been doing. And in fact, before I started in 2017, there was already a study on the quantifying air pollution exposure to babies in prams by Professor Prashant Kumar, and this was published, and then it sort of gave us the idea and brief sort of overview how do we expand this topic, because it is such a sort of serious topic, because the health impacts of air pollution exposure to young children is such a burning topic. And then there are some other guideline documents, such as the focused on the green infrastructure solutions to mitigate air pollution exposure. And then these were basically sort of based on how do we design green hedges, and based on the sort of the typical street canyons, their geometry, whether they are rural, whether they are regular, narrow, or depending on the height to width ratio of these street canyons. And then we also engage in a lot of citizen science activities, as you see in this one of the citizen science activities, which we conducted recently at the car-free day in the Guildford Town Center, a very nice sort of sunny day. So here we are telling this to the audience about how they can take this quiz to really assess the air pollution exposure concentration levels. And then this sort of tool comes up with some sort of recommendations how citizens and the students can mitigate their personal exposure level. As well as there is an ongoing sort of living lab, which we call as Guildford Living Lab. This has been here for a while now. It collects real-time data with all the sensors at some of the top pollution hotspot areas. And then we have this tool which have emerged from some of our projects in the green infrastructure solutions. This is the hedge date tool. Here you can input the dimensions such as the distance of your house from the street, and then it come up with some sort of tailored sort of solutions and suggestions for the green species selection. So the primary sort of motivation and background for this research project was the serious health impacts of air pollution exposure to young children, particularly. As we know that the young children are at growing stage where their health systems are developing, and they are so sort of vulnerable and susceptible to the similar sort of air pollution doses to which adults are exposed to. This is primarily because they have developing bodies, developing health systems, and as well as their breathing rates are quite high, almost double compared to the adults. As well as the young children are primarily, they are very high functioning population cohort. Their activities are very diverse. Their sort of physiological characteristics are also very different compared to the adults. So without getting into too much into details of the diverse sort of health impacts of air pollution, but some of the key health impacts I would like to focus is that it affects their respiratory health, it affects their cognitive functioning, it affects their academic learning outcomes, such as it affects their IQ and brain development, and also it leads to different sort of allergies, particularly, I mean, the children who are already suffering with pre-existing asthma or emphysema or any other respiratory diseases are particularly more vulnerable. Now, in order to sort of, to validate that how serious this issue is, you can look into this some of these key stats from the UNICEF 2018 report, which says that uh, 1 out of 3 babies are growing in the UK with the critical levels of air particulate matter air pollution levels. And the figure is almost like 270,000 babies under the age of 1 in the UK are sort of suffering and vulnerable. And when we increase this age bracket to include 0 to 5 years old, then it's a whopping 1.6 million under the age of 5 who are suffering with the critical and serious health impacts of air pollution exposure. Now, first, we sort of, in order to sort of start this research project, we did a very thorough and critical and comprehensive literature review. And it posed a challenge in a way that because there was only one research paper based on prams, exposure in prams, and that too was from our research group only, published in 2016 by Professor Prashant as a leading author. And so there was a challenge. So every sort of novel study always has its pros and cons and has its own sort of challenges. It posed a challenge that, there were lot of sort of background work was missing in terms of defining the sort of classification of prams, and what sort of prams are there, what could be alternative transport microenvironment at low rise sort of transport microenvironments, and then also sort of other passive control mitigation technologies. So first we started, we understood that there is a gap in terms of the exposure quantification in different types of prams, both single, double, and also the replicate of pram, like sort of alternate transport and one microenvironment to pram, which is the bike trailer, which are not so much popular in the UK, as you see. But of course, like sort of Denmark and some of the countries are really leading in terms of coming with innovative and novel solutions, such as the cargo bike trailer. And this came to our sort of idea when we saw this sort of a campaigner based out of London. I guess his name was David, and he was posting on Twitter that, I mean, this could be one of the novel sort of transport microenvironment for babies. And we were so motivated, we just started discussions with each other, me and Professor Kumar, and with this guy also, then what could be the solutions to really quantify the exposure in the bike trailer as well. And then also the surrounding sort of mitigation sort of strategies are also missing for pram and bike trailer, particularly in terms of covers. There were no systematic study assessing the efficacy of pram or trailer covers. And then in terms of the personal exposure mitigation, such as the face mask or any sort of clean air devices which can be fitted into prams or bike trailers, there was one device which was developed by our industrial partner Brazil Limited. We did tested the device, and it was good, but it did needed some sort of improvement. And then the manufacturer, our industrial partner Yossi Romano, he sent the device to China for manufacturing improvements, and then it is still sort of in progress. So the brief sort of overarching sort of aim for this project was to really experimentally and theoretically quantify the differential air pollution exposure of babies transported in prams or bike trailers, and how they compared to the exposure levels of adults, and if there are any mitigation strategies, viable mitigation strategies, and in terms of pram or bike trailer covers, and also in terms of novel and innovative filtration materials such as face masks, which can be sort of not only used as face masks, but also which can be which have transferable sort of characteristics to be able to be adapted and tweaked to fit into sort of in pram and in bike trailer sort of mitigation technologies. So as a first sort of objective, we via literature review, we sort of quantified the exposure in different sort of prams and bike trailers, and then we assessed the physicochemical characteristics, and then we validated it via mobile experimental campaign, which, as you see, is the objective 2 or part A. And here we sort of experimentally quantified the exposure in prams, and then as a next step, we quantified exposure in bike trailers and compared it with the cyclist exposure. And then as a next step, as objective 3, we looked into a very diverse range of face mask and filtration materials. And we utilize our state-of-the-art, in-house developed this laboratory filter testing setup, which we utilized to test almost 11 different types of face masks, including almost 3 broad categories, such as respirators, FFP1, FFP2, FFP3, and then surgical mask, and 4 types of handmade masks. And finally, I think this, I can say this has been a sort of very thrust area, given also our motivation and sort of our obligation to really inform the public about what are the challenges in terms of exposure of babies in prams and bike trailer, and what could be the, how we as individuals could make a difference to sort of fill the gap and connect the dot in terms of designing novel mitigation strategies. So we sort of combine all our key findings, evidence-based findings, I would say, and then we sort of come up with a very refined sort of tailored mitigation strategies, we can say take-home messages for the school authorities, school children, parents, and senior citizens, and how we can together sort of make a difference by working together and then tackling these exposure levels. So as first steps, first thing first, I guess. So first steps, we really sort of come up with this gap, which is like a systematic classification of different types of prams was missing. So we assessed the gray literature mainly because there was no scientific peer-reviewed study at that time. So we quantified these sort of prams based on number of wheels and seating capacity, and how far are they from the vehicle curbside when you sort of carry these trailers. This was published in our first review paper, which sort of managed to get a lot of media highlight and publicity as well. So we found that pram widths varied in this region 0.56 to 0.82 meter, and the handle height was up to 1.25 meter, and the breathing height was within 1 meter from the road level. So all these sort of field experiments were carried out on a predefined route. We started from GKR, University of Surrey premises as an origin, and then we traveled all the way. We designed this route passing through major traffic intersections and urban pollution hotspots, including the bus stations, traffic intersections, and this was sort of optimized to cover as many traffic intersections as possible. As you can see, this is the PM10 concentration profile as well. As you can see, the concentrations are generally higher at the traffic hotspots, while they are also higher at some of the street canyon environment, which typically act as urban pollution hotspots because the pollution is sort of trapped within these narrow street canyons. So we did experiments in different sort of by different sort of prams, including the single pram facing parent, as you see in the first picture, and then also in the single pram facing roadside, and then single pram facing roadside with the in-pram clean air device, which is a device which was manufactured by our industrial partner Brazil Limited. This is a sort of pillow which sucks dirty air and pushes through the HEPA filter, and then creates a sort of clean air zone within baby breathing area. And then we also sort of did some experiments at different sitting heights of double pram, bottom and top seat. So moving towards our next steps, these are some of the key findings from our review paper, which we published into Environment International, as Seppi informed us in the beginning. This is how, as a graphical abstract, this panel on your left, it shows that this is how babies in prams are transported in a typical roadside environment. As you can see on the left-hand side, there is this concentration profile, and on y-axis you see this wind profile, and how this wind is sort of transporting all these pollution at vehicle tailpipe height to the in-pram baby breathing zone, which is 0.85 meter, but located well within 1 meter from the ground level. As you can see from our other studies as well and existing literature as well, you can see that the air pollution basically follows an exponential distribution. So it basically decreases exponentially with height. So first 1 meter is critical. You see higher concentrations at 1 meter above the ground level. And this is how they are exposed. And on the right-hand side, you see that how complex mixture of pollutants, or sort of cocktail of pollutants, is left behind by all these vehicles passing from morning till evening throughout the day. And all these pollutants are basically making a very sort of complex cocktail and concomitant of all these pollutants. And all these pollutants are then sort of slowly with the wind and vehicle produced turbulence and atmospheric produced turbulence are transported to the in-pram breathing height towards the vehicle towards these pedestrian footpath. So there are two main sort of wake regions when we consider these exposure to baby breathing height in prams. First is the near wake scale, which is directly behind the vehicle tailpipe, and this is predominantly influenced by the traffic produced turbulence. And then there is the far wake region, which is primarily influenced by the wind produced turbulence. So as we have now sort of discussed how the exposure varies at 1 meter from the road level. So in order to target any exposure sort of mitigation strategies for in-pram babies, we should be always careful to sort of address this first 1 meter from the ground level. And then in terms of other sort of passive control mitigation strategies, we found and addressed in this study that both technology and community driven measures are essential. So there is not actually one magic sort of bullet which can, you know, solve this serious issue of air pollution exposure to young children, but there is a very sort of, you know, holistic strategy is needed, a multi-pronged, multi-dimensional approach is needed to address all this exposure issues of babies in prams. Now, as next steps, these are our findings from the experimental measurements in bike tread alerts. And as you can see from the graphical abstract on the left-hand panel, that it clearly shows the relative concentration at baby versus adult height. And this is for better sort of for improving the visualization of how these differences sort of can be visualized and experienced and seen clearly. So you can see that the concentration at in-pram height are clearly much higher than the adult height, and the ratio is almost 2. And on the right hand side, you can also see from the quartile and peak exposure analysis that the top quartile exposure at in-pram height is much higher than the adult height. So it shows that the pollution hotspots are really critical when addressing and tackling this issue of air pollution exposure to young children. Now, in terms of mobile measurements in pram, these were the highlights we see these are consistent with our previous objective, that babies were exposed to up to 44% higher exposure compared to the adults. And there was also a significant variability in different runs during different times of the day versus different sort of transport microenvironment, whether what sort of prams we are selecting. So there are these variabilities because atmosphere, we know that with the field experiment, there are always challenges, and there are many factors which are beyond our control. Particularly the meteorology is really sort of predominant factor which is beyond our control. So consistently we can see that as the height of the baby breathing zone is lower, higher is the exposure. And in terms of tackling and addressing this their exposure at the pollution hotspots, we found that both pram and bike trailer covers are effective at curtailing the exposure. The trailer covers effect I'll discuss in the next slide. And as a next sort of assessment of the physicochemical characteristics of these pollutants at baby versus adult height, we found that the source sort of classification, source apportionment of all these pollution revealed with the same analysis, we found that there was a predominant contribution from the brake and tire wear emissions at the baby breathing height. Now, compared to the adult breathing height, the predominant contribution was from earth crust elements. And as we know that the vehicular emissions are much more toxic compared to the earth crust elements. Uh, Now, in continuation with our mobile experimental campaigns, this experimental campaign we conducted and designed for bike trailers, as bike trailers are also almost similar sort of, transport microenvironment, but since they are attached to a bike, so the exposure and journey time is reduced. So while the journey time was almost 30 to 35 minutes in different sort of prams, the journey time here in these bike trailers was almost 10 to 15 minutes maximum. So you see that the exposure time is reduced. So the time the babies could spend at the urban pollution hotspot is reduced. And then also the concentration dose is also reduced, because then the concentration dose is also a factor of the time spent and the concentration level. And so all these sort of 2 or 3 factors. So the findings were again sort of consistent. We found that concentrations at bike trailer height were almost 14% higher for fine particulate matter compared to the adult height. And again, the concentrations were significantly higher by up to 50% at the urban pollution hotspots, particularly at the peak morning times. And in terms of curtailing emissions at urban pollution hotspot, we found again that bike trailers were effective at curtailing fine particulate matter exposure by up to 50%. And in addition to all these interventions, what we did here, there was one more sort of novel approach we adopted here. We also looked at how intervention targeting on-road traffic can be helpful at curtailing the exposure levels of not only the children but also adults. But we mainly sort of focus on how the strategies to reduce on-road traffic can be helpful at significantly curtailing the emission exposure in prams or in bike trailers. So we sort of assessed the impact of COVID-19 lockdown. So we did a sort of experiments and measurements before lockdown and after lockdown, and then we sort of try to come up with the differences in terms of reduction. And to our surprise, we found that almost the COVID-19 imposed lockdown sort of reduced fine particulate exposure by up to 90% at bike trailer height. So this is quite novel, and this paper is about to be submitted. We did not find many studies which have incorporated the effect of COVID-19 lockdown, particularly in these sort of transport microenvironments. So you will see this research paper very soon coming up. Now that we already sort of assessed the main sort of reason, and that we diagnosed the major issue, which is that babies in prams and bike trailers are exposed to higher concentrations. And we, to an extent, sort of also discussed, like, that pram and bike trailer covers could be effective at curtailing exposure. But I think that's not the end or the solution to this problem. Therefore, we went to a next step. And here we sort of looked into the filtration efficiency of a wide range of filtration materials, particularly 11 types of face masks. And this study was published into one of the high impact research journals, which is Journal of Hazardous Materials. And as you can see from this graphical abstract, that in terms of the holistic performance assessment, we sort of classified all these different face masks into 3 categories: the handmade, medical mask, and respirators, and the best performers, mediocre performers, and the lowest performers. So on y-axis, you see this is the estimated potential usage time, and this has never been reported in any filtration of face mask studies before. So this was one of the primary novelty of this study, apart from other sort of novelties, such as in terms of focusing the holistic assessment of face masks. On y-axis, you see the quality factors. So the guys on the top right side are the face masks, are the filters which are the most efficient. Mostly they are FFP3 respirators, followed by FFP2 and then FFP1 respirators. And then in the middle, the mediocre performers were these guys which are like medical or surgical masks. And then in terms of poorest performance, we observed that handmade masks were the poorest performers, and for a wide variety of reasons, including the sort of porosity type of material, the fabric material, the porosity, and also, like, sort of the GSM of these materials. And also, I think one of the important factor was like the face mask fitting, how you fit these, how you wear actually these face masks, and how many leakages you are having on your face at these connections of this face mask with your face. I think these openings are sort of really predominant in terms of influencing the exposure concentrations entering from the face mask. So in terms of size segregated efficiency, sorry. So this is another plot. It shows the filtration efficiencies of all these categories of face masks. And you can see that respirators, which are the top performers, are having very slow sort of variation of their performance across different size ranges. Whereas when you see the handmaids, they are showing a wide variability. And during the first few minutes of the measurements, the variability was much more significant, which was then later reduced. We looked into different aspects. And if you go through this research paper, you can find how comprehensively we have assessed the different sort of performance indicators. So this was the typical setup for a filtration laboratory experimental measurements. And I'll not go into the nitty-gritty of explaining all the details of this experimental setup, but I can give some sort of brief snapshot of how we designed and how we conducted the experiments. So the very first thing you start, this is a sort of chamber with a sort of 40 by 40 centimeter by 40 by 40 centimeter. And then at the point one, here we sort of take the compressed air, the ambient and from the ambient environment basically, and then a part of it goes into this one of this tubes, and the part of it passes through this aerosol generator, which is number 4. And then all these aerosols which are generated, which are salt-based aerosols, potassium chloride aerosols, they then passes through dryer, so that all the moisture and humidity is sort of removed from these aerosols, and then they are mixed with this ambient air for the dilution purposes. This then passes and enters this chamber, which then has a fan for dilution of all these aerosols, and then it passes through this test filter holder, and we are sampling both before and after the test filter holder via a very novel experimental setup using a very high-end particle aerosol spectrometer, which is DMS. DMS is gives you size segregated measurements, as you see at the bottom. This is a very high-end sort of instrument. This has been in fact used by Sun Labs in Switzerland for the aerosol sort of measurements as well. One of the novelty of this study was also that we are sampling at a very sort of shorter time lag. There is in fact no time lag in terms of the residence time of these aerosols in the tubes is really very small, because we are directly sampling right before the filter sample and right next to the filter sample in the downstream side. This is the cross section of these filter samples. 2 by 2 centimeter basically was the size of the filter holder. Now, in a nutshell, to summarize some of these, sort of evidence-based findings, this was the last chapter of my sort of PhD thesis, which is submitted and also recently defended, got the official confirmation from doctoral college only today. So, in terms of the mitigation interventions, we divided these interventions in terms of general interventions derived from literature, as well as some of the existing studies and our guidance document as well, which we discussed previously, mitigating air pollution exposure to children in and around schools. So as a rule of thumb, 2 or 3 things we can always say and feel very confident is that we should always promote parents and school children and school authorities and citizens, local citizens, to always prefer cleaner alternative routes, having very less traffic concentrations. Now, there could be trade-offs in terms of, these cleaner routes could be longer compared to the shorter, more polluted routes. But then we have to do optimization in terms of, if you are choosing these cleaner routes, then make sure that you are not ending up increasing your vehicle kilometers driven with a dirty diesel car or bus. Then basically all these benefits will be outweighed and sort of, surpassed by the negatives compared to the positives. So you have to be a bit careful that cleaner routes should not be really very, very longer compared to the shorter polluted routes. So there has to be this optimization. There could be some sort of algorithms or apps or whatever to come up with that. That was not part of this research project. And then other sort of, as a rule of other sort of evergreen strategies, which I can say is that always prefer active modes of transport. Parents and children and should always be motivated to walk to schools basically, or if or to sort of cycle, use bikes to commute to schools. This will ensure that we reduce the exposure due to more and more private cars on roads. We have to always ensure that we minimize the number of cars on roads, and if at all not possible to minimize the motorized transport mode, then we should always try to prefer public transport mode compared to the private modes. And now I would like to focus on some of the targeted mitigation strategies, which is like focus around the selection of prams and vehicle idling and all. So when it comes to selecting a type of pram, we would advise parents to always prefer a pram which has higher breathing height. And later I'll show you one of the interesting picture that what sort of high rise prams you can select. So we suggest that parents should always prefer a type of prams which are high rise, which are facing parent and not facing the roadside, so that we can sort of, with the use of some barrier, we can sort of curtail direct exposure of babies to the on road vehicles and emissions. And in terms of trailer and pram cover, we would suggest that this could be the sort of one of the consideration. We don't say that this is set in stone, so you may not want to quote us that XYZ group sort of quoted this as a mitigation intervention, but we could say these are effective to an extent, particularly at urban pollution hotspot in cold weather conditions. And we also give a warning and sort of this disclaimer that try to avoid the use of pram covers in the hot weather conditions, because then CO2 concentrations are built up and they almost create like chamber-like conditions inside prams or bike trailers, and then it impacts the breathing comfort of the babies inside the prams. Of course, these pram and trailer covers always comes with porosity. They are porous and designed as porous materials. They have some inbuilt holes by the manufacturers. And also, like the other sort of strategy we would suggest is that parents, while dropping off their kids and collecting their, and while also pick up of their children, they should always try to avoid vehicle idling, and there should be policies around that to avoid the idling of vehicles. And as much as possible, the parents should try to park their cars far from the school children playgrounds, where so that school children are not directly exposed to these exposures from tailpipe. And one more strategy which requires sort of integrated efforts from school authorities, community scientists, and urban planners and town planners to work together from the very beginning. This is about planning schools away from busy roads, but rather than looking for a mitigation, we should always try to adopt a preventative methodology. So what we say is that while planning the new construction, new school sites, the school authorities, counselors, and school districts should always be careful in planning the schools sites which are located far from heavily trafficked roads, and as well as possible, they should always promote a very sustainable mode of transport to these schools. Always make sure that when you choose public mode of transport, then you don't end up increasing your vehicles miles traveled, and try not to use sort of heavily polluting diesel sort of buses. So this is some of the media coverage we got for the research project. This was widely covered by BBC, UK Daily Mail, Telegraph, Huffington Post, and many others, which I can't list in this. Almost 50 plus international media highlights. This gave us really sort of very high motivation to really, contributing to this research project. And particularly, I'm very much fascinated with this sort of encouragement that, the media and governments and local councillors in the UK and the advanced countries are so much motivated, and the authorities in the UK are so much serious about the health of babies. And particularly the one of the stories which I liked was that, this the Telegraph story, who sort of draw an analogy with this, with Prince Charles and his wife, and how we should switch back to the traditional modes of traditional types of prams, where they are really high rise, and you can see the baby is almost surrounded by all these physical barriers inside pram. So as they say, I mean, old is gold and old may be gold. So, it's not bad to, switch back to our all sort of traditional practices. So thank you so much. And now I would like to switch back to SAPI and stop this presentation for Q&A session. So
thank you so much, Ash, for that wonderful webinar. Lots of interesting points to reflect on and a really comprehensive overview. Definitely a topic that needs to be discussed more. We'll now be moving on to our Q&As, and our first question comes from Maya, and they say, will you consider the effect of air pollution on babies in carriers and slings, as they're typically higher than prams?
Yeah, very interesting question. And I am to an extent familiar only, but we did not consider, the sort of pouches. I guess the audience is referring to the sort of pouches, when you carry that baby in that pouch. I think in one of the school children guidance document, which is published by GKR itself, and also in my last final PhD thesis chapter, which we plan to submit, publish at some point, we try to highlight that wherever possible, parents should try to use pram or bike trailer cover, but at the same time, if possible, if the parents are sort of carrying these children in these such pouches or carriers, then they can sort of what they can try is that they should try to hold these babies at relatively higher height. Like if I mean, as much as possible, if we can sort of try to avoid direct exposure of babies to the vehicle tailpipe. Now this is a as a rule of thumb, we should always try to avoid the facing of babies from the vehicle tailpipe as much as possible. And we also give a cautionary note that parents should also be very much serious while doing all this, about road traffic safety as well. Because if you're trying to face your baby away directly from from the vehicle tailpipe emissions, then you have to be careful when you are sort of moving away, because road traffic safety is also one of the important criteria. But I mean, coming back to this question, I think I would really love to do some more experiments in collaboration with other potential collaborators in future. And then we would also like to compare how exposure in these pouches compare with the exposure in baby prams or bike trailer. But as of now, what we can say with our finding is that if possible, parents should try to prefer bike trailers compared to prams if possible. And it should be also noted that not everyone is equally familiar of riding a trailer attached to a bike, because it's really tricky. I did experiment myself. I'm not much of a cyclist though, but I would say that driving a bike attached to a trailer is a bit tricky. So we would say when you are moving farther out, in the outskirts of your cities, then I think of course you can't push a pram. So we would suggest that they could use a sort of bike trailer, and they could, whenever they plan sort of small picnics and that sort of thing. So as of now, because the journey time is reduced when your bike trailer is attached to electric bike, so of course that the exposure is reduced. Yeah, I guess slightly I answered the question, but not exactly. Yeah.
Well answered, thank you. So next question, pram trailer covers might lead to suffocation. What is the workaround for this?
Yeah, I think this is very well picked up by the audience, and thanks for pointing out. And as I do try to sort of reinforce that all these trailer covers and also the bike, the pram covers always have some porous. They are very porous and they come with openings. Now all these openings, and also especially in terms of trailer covers, I personally has noted these, how many openings are there. And I think there are a lot of openings. So use of these trailer covers is not at all, harmful in the cold weather conditions. In a weather like UK or US or Canada or typical European weather, I think there's no problem of suffocation. But if you want to use this trailer cover in Australia or India or Africa or South American hot countries, then of course you have to be really cautious. But if they are coming with openings, of course they are coming with openings, then at urban pollution hotspot, they can use for some period of time. Let's say there is a three-way intersection, you can use this trailer cover because it has openings, and 5 or 10 minutes will not definitely lead to that sort of suffocation levels. So yeah.
Fantastic. Demi asks, can we say that children in bike trailers are less exposed than those in prams?
Yeah, I mean, we can broadly say a few things, but again, yeah, don't quote us on this, that, because I think we are sort of first in line with conducting this study. And how we scientists sort of develop confidence is that when we see a series of experiments in different cities across different geographic locations, then we can say very confidently. But given that these experiments are first in line, conducted globally, so we can say yes, as of now, with our results and data, we can say that trailer within bike trailers, babies are exposed to lesser concentrations. But I think in one of our sections of future recommendations, we have clearly mentioned that we need to build a very diverse and complex database in order to speak with confidence, because this topic is really very, very sensitive topic. So we don't want to say XYZ things, but at the same time we can say that as of now, with these detailed and comprehensive experiments, we would say. But at the same time, we would highly encourage other researchers to pick this research from here and to build diverse and comprehensive databases, not only for experiments in different sort of prams and bike trailers with trailer covers and pram covers, and particularly with the CO2 concentration source within the trailer cover, so that we try to mimic inhalation and exhalation cycle, because then only we can say, because right now we were not having any exhalation cycle, we were only having instruments, we were trying to mimic basically the babies in prams or bike trailers. But it will be good to have a CO2 source inside to really see. But given that they are really open to the environment, so when there's exchange with the ambient air, then I don't see that even the CO2 source inside the trailer cover will make huge difference, basically, because we looked into CO2 concentration as well as adult height and trailer height. So as of now, yes, I think we can say yes, they can go ahead with the bike trailer.
Thank you, Ashish. And I'm going to ask just one very last quick one by Robin. And they ask, who have you found to be the most interested in your study? Parents, schools, research scientists, or pram/trailer manufacturers? Thank you.
Fingers crossed, by the grace of God, actually, the level of interest we got is, is really high. We got a lot of, response from school, there's a lot of schools, and we are doing a lot of campaigns locally in Guildford as well as in London. Some of my colleagues are working with a Guys and Thomas charity organization, and we are having a lot of systematic measurements. So we got a lot of interest from school authorities as well as parents, because we do a lot of community outreach activities, and also because we do citizen science activities. So in fact, children are also really curious, and when I was doing sort of my experiments, and everyone was really curious, and in fact I was stopped and they politely asked me, I mean, this is so interesting what you are doing. So, but I think I would say that and in fact, one more thing I would like to say, we got a lot of interest from campaigners, NGOs basically, who were tweeting on Twitter and LinkedIn, and so the interest has been really huge and quite motivating, inspirational, in fact.
That's amazing news to hear. It's really good to get so much interest from different groups. So thank you again, Ashish, for presenting. And that's it from us today, attendees. Thank you so much for joining today. I hope you enjoyed it and found this webinar informative and beneficial. This webinar has been recorded and will be made available on the IES website and YouTube channel. If you're watching the recording on YouTube, please subscribe to our channel, like the video, and hit that notification bell to gain notification of new content. And I just want to thank everyone for attending, and Ashish one more time. Have a wonderful afternoon, and bye for now.